News anchor Mary McKenzie. And Mary, a local man who once worked at the White House, compared medical care there to an emergency room.
The president going home to a house that looks much more like a hospital than yours or mine.
It can handle pretty much anything that comes up, unless it's something serious, like a serious infection, in which case that too can be handled as long as you bring in all the gear and all the testing, so you can test the lungs and test the oxygen levels and that sort of thing.
We spoke to a former media advisor to President Carter who described the care the president has access to. He says the medical office within the White House is part of the military office, and all staffers there, he says, have access to the doctors for any kind of emergency. He says, in fact, it does function much like an emergency room. You wouldn't go there for your annual checkup, for instance, but you could go there for anything else that came up while at work. And for the president and the first lady, there are doctors who are dedicated full time to their care specifically. After the president, though, spent 3 nights in the hospital with COVID-19, it's unclear right now what treatments the president is receiving now.
Because we don't really know. We're not being told what has happened. And one of the advantages to a president of going into the White House for treatment as opposed to in a hospital is that it's pretty secretive. And no one has to say anything.
We are close to, worth pointing out, we're close to that 7 to 10 day window that doctors have said throughout the pandemic is so crucial for this virus, that so much can happen during that time frame. The doctor saying that he was well enough to go back to the White House, but of course he can receive 24/7 care there. We're live along the Embarcadero. Mary McKenzie, ABC 10 News.